Welcome. My name is Dr. Joshua Malley. I'm a board-certified ophthalmologist and vitreoretinal surgeon in Sarasota, Florida. I'm also serving as the Retina Medical Director of the Macular Degeneration Association. And also, I'm the founder and CEO of Malley Enterprises. Welcome to another great episode of the Retina Project. So I thought I'd spend the next few episodes talking about a topic that usually doesn't get too much airplay with retina specialists or even patients, frankly, and that's retinal vein occlusion. It's certainly a diagnosis that we see in clinical practice, and certainly one that in the top three conditions that we see in retina practice in particular. Obviously, wet AMD and diabetic macular edema are the top two. And I think sometimes retinal vein occlusion gets kind of a back seat and doesn't get enough attention and kind of focus on, how we talk to patients about retinal vein occlusion, disease education management, as well as, treatments and other workup systemically as well. So I thought I'd spend a few episodes in this next series here talking about retinal vein occlusion and go into more details about what I've learned throughout the years and how I talk to patients and the important points that I think that us as retina specialists we need to really get across to patients and help them to focus on the important things in this condition to help understand it better and help to educate them more on retinal vein occlusion. So I'd go over my Dr. Malley's top three things that I tell my retinal vein occlusion patients. The first thing I talk to them about once we make the diagnosis is there are actual risk factors that that cause them to develop this condition in the first place. I mean, the classic first question is, well, how does this happen, doctor? So I think it's really important to stress the important risk factors that contributed to their development of a retinal vein occlusion. So as a lot of our audience knows here, the key risk factors that I've found are important to communicate to the patient are advancing age. So as you know, as patients get older, they're at higher risk for developing a retinal vein occlusion. Obviously, systemic risk factors are important. Things like hypertension, diabetes, hyperlipidemia, coronary artery disease. These are all kind of important factors to consider in these patients, as well as if they have a history of a retinal vein occlusion in the other eye. So that's also obviously a risk factor for them as well. And then finally, there are some risk factors that are really associated with central retinal vein occlusion, and that includes glaucoma and carotid occlusive disease. So these are kind of the main things that I talk about with patients that I think are important to go through and discuss with them to make sure they understand, these are things that could potentially be treated or monitored to help to reduce risks of developing either another vein occlusion in the other eye or to improve their overall health maintenance. So I think those are really important to discuss. The second thing I would like, I always discuss with patients and I want them to know are what are the consequences of having this vein occlusion. And I think I always just say, keep it simple. There's two important consequences when you develop a retinal vein occlusion. Number one is you get swelling in the retina or CME. I think it's important to show patients the images, whether that's a fundus photo with their bleeding, as well as an OCT to show them the actual thickening of their of the retina. So I think that that's an important show that visualization of the consequences because it helps them to understand it better. And then obviously the second consequence that we always worry about with retinal vein occlusions are neovascularization. And again, as we all know, I always stress that that's the importance of close follow-up examinations for the first 6 months on a monthly basis in order to help detect that neovascularization risk. So I really communicate that to the patients to make sure they understand that and why we're following them so closely, especially in the initial period of time with like a CRVO, for example, because of that risk of developing neovascularization. So again, I think visual aids are a great way to help explain that and do that. And then the last thing I recommend or I talk to patients I want them to know about is that there are treatment options if they have these consequences. So, I'm going to talk about this in a later episode, but certainly I just generalize it and I say, okay, we have two classes of medications that we like to use to help treat, retinal swelling as well as neovascularization or development of new blood vessels. And two classes, anti-VEGF treatments, that includes Eylea, Lucentis, and Avastin. And then we also have the steroid class, which is really focused on treating the swelling part, or the CME part. And that's Ozurdex, which is intravitreal steroids. So I like to kind of give them an overview of what to expect, as well as the way that I usually treat patients with a treat extend protocol. And I just kind of lay that out there. Those are the key things that I think are the most important for patients to know, at least on initial visit with the retinal vein occlusion. Let me know what you think, and please stay tuned for the next episode where I'll go into more details about this. Thanks.